From about 28 weeks, a baby starts showing signs of readiness to start rooting and latching onto the breast. And the signs that you're looking for are a baby nuzzling their heads into your chest, or maybe they start migrating themselves sideways while you're having skin to skin, or maybe they start licking their lips or doing these sideways opening mouth gapes. They're all signs that your baby is wanting to start having a try at breastfeeding. So you'll get given your baby for skin to skin on your chest in this kind of position. And that's a really nice place to start. Your baby can smell your milk and they'll show you those signs of readiness. But it can be quite daunting to move your baby into the correct position for breastfeeding. So what I recommend you do is you practice while you're having skin to skin. Have a practice of seeing how your baby feels. So put your hand on behind your baby's shoulders, not on their head, but behind their shoulders, and your finger and your thumb will usually come up to kind of around their ears and around the sides of their jaw. And then put another hand under their bottom and just bring them out so that you're holding them in the palm of your hand and feel how secure they are. Even though your hand isn't behind the head, it's behind the shoulders. Feel how secure your baby feels. And that's a really important skill to then be able to move your tiny premature baby into position for breastfeeding. So the acronym we want for correct positioning for breastfeeding is CHINS. So you would like your baby to be close, which means that you don't want lots of blankets and things in between. You want them to be right next to your chest, really close to you. You want their head to be free, so you don't want your hand on their head. They need to be able to tip their head back slightly to be able to latch onto the breast correctly and bring their chin to the breast first. Your hand will be behind their shoulders. You then want them to be in line, so you've got C for close, H for head free, I for in line. And that means you don't want your baby twisting their head from side to side or to have their chin on their chest. You want them to be completely flat and in line with your breast and facing you. Okay, you also then want, most importantly, to be nose to nipple. Okay, so the nipple is lined up with the nose and your baby's chin is right at the base of the areola, so that when they latch onto the breast, they latch with their chin first, their mouth is open, and they go up and over onto the breast, and they end up taking a lot of the areola, which all disappears. You think your baby's got a tiny mouth, but they can open their mouth exceedingly wide. So that's the position that you want for breastfeeding. Remember the acronym CHINS. Now, remember, your baby's been born prematurely. They do a lot of sleeping. So in all honesty, they might just take one look and fall asleep. Another time they might take 2 looks and then fall asleep. And those 2 looks might then move into 1 latch before they fall asleep. And that 1 latch might turn into a couple of sucks. It's really important that you empty your breast as much as you can before you do breastfeeding practice until you're absolutely sure that your baby is able to do suck, swallow, breathe on a volume of milk. So while your baby is still under 31, 32 weeks, make sure that you are expressing before you're doing breastfeeding practices. And then you might even notice that they manage to latch on and take a couple of sucks before they fall asleep. And then those little clusters of sucks will move into clusters of 5 sucks, 10 sucks. At that point, if you can see that they're coping on a relatively empty breast, you can start increasing the volume of milk that you leave inside your breast. So you might half express before you offer them the breastfeed. By this stage, you're usually somewhere between 32 and 34 weeks. But you want to be very, very careful. Around 34 weeks, a baby's suck, swallow, breathe pattern is becoming more established, and that's when you can start offering a fuller breast before breastfeeds. And you should start noticing as well that babies are waking up for a couple of feeds a day and that they are going for slightly longer on the breast, and those couple of sucks will build up to sucks of maybe 5-10 minutes. Once you reach 5-10 minutes of sustained sucking, you can start considering reducing down the amount of top-up they get via their NG feed. So up until that point, we'll be giving them the chance to try and breastfeed, but we'd also be topping them up with a full NG feed volume after their breastfeed attempts. But once you can see that they're taking a sustained volume from the breast, and especially if you feel there's a difference in your breast before and after your baby has fed, we can start reducing down the amount that we offer them afterwards, or even stop offering them that top up and see how long they settle for. And that's where we move into responsive breastfeeding. It's really important, though, that you continue to empty your breasts after breastfeeds until you're absolutely sure that your baby is draining the breast well, gaining weight beautifully, and is settling in between feeds before you stop expressing. So the likelihood is that you will go home responsibly breastfeeding, but continuing to express after breastfeeds for a good few weeks until you've seen that your baby is able to breastfeed responsively and draining the breast well and gaining weight nicely. And at that point, you can start reducing down the amount that you express after breastfeeds until you're just responsibly breastfeeding your baby around the clock.